Oral candidiasis is defined as fungal infection of oral cavity which is caused by Candida albicans. Although there are other 7 different species of Candida which can cause oral thrush, albicans is the common one leading to formation of oral thrush. Albicans basically means white. It is also called as oral thrush because it resembles the breast of thrush bird. You can see thrush bird here. This is the breast of thrush. The picture in the oral cavity seems like this: white patches in the tongue. Candida albicans usually stays as a commensal in mouth of around 50% of populations, but when the immunity of the person decreases, then it can act as the disease-causing agent and it will cause the disease. Common risk groups which can acquire oral candidiasis are general debilitating disorders like diabetes mellitus, AIDS, and COPD. Especially in patients with chronic pulmonary obstructive disease, they will take oral inhalers. The inhalers might cause oral candidiasis. Prolonged antibiotic therapy leads to immunocompromised state. Anticancer chemotherapy, patients having cancers. Prolonged use of steroids that decreases immunity also. And there is chance of superinfection by other organisms, so fungus infection can acquire. People with dentures are prone to have fungal infection, so they have to clean the dentures time by time. We'll come later on the slides. And conditions leading to dry mouth, like patients using antihistamines or patients having Sjogren's syndrome, where there will be dry mouth and there will be chance of fungal infections. Oral candidiasis can be classified as acute and chronic stage. Acute stage there will be multiple small white patches on the oral cavity, oral mucosa, which when wiped off leave erythematous patches. You can see here, this is the acute stage of oral candidiasis. This is the white patch as you could see previously on the breast of thrush. They are quite painful. They are seen particularly in buccal mucosa and soft palate. You can see in the oral cavity, in the tongue also. In chronic form, they are white lesions which cannot be rubbed off and they are widespread lesions. This is the chronic stage of oral candidiasis in the tongue, where there is a white lesion which is widespread lesion. It is common in buccal mucosa, just inside the corner of mouth. You can see in the corner of mouth also in the buccal mucosa, but I have shown the picture in the tongue. How to diagnose oral candidiasis? Most of the times, you can diagnose clinically yourself by looking at the picture of the tongue, buccal mucosa. Sometimes, if you cannot diagnose, then you have to ask for QS mount. The microbiologist will see the fungus there. Staining with PS, periodic acid safe. Again, the microbiologist can tell you it's a fungus, and sometimes fungal culture. Once diagnosed, we have to treat the patient. Treatment can be performed by different methods. They are local application of nystatin, antifungal agents, clotrimazole, or amphotericin. The patient requires medicine for a longer time, around 4 to 6 weeks, or sometimes more than that. When the patient has systemic fungal infections or when the infection is widespread, then we have to use systemic antifungals like Ketoconazole, Itraconazole, or fluconazole. When the patch is bigger, when there is a large patch in the oral cavity, then sometimes the patch needs to be removed with surgical treatment. And the most important factor is correction of underlying cause like diabetes, hypertension, COPD, like that. How to prevent oral candidiasis? As we have told, it is found in many individuals. It can be prevented by practicing good oral hygiene like brushing the teeth regularly, at least twice a day. Use warm or saline gargle twice a day, using saline gargle only, the salt water gargle. Avoiding of antiseptic mouthwashes for a longer time because they'll kill the local bacteria which are good, and then during that time the fungus can overgrow. So don't use antiseptic mouthwash for a longer time. Last, if the patient is using a steroid medicine or inhaler for asthma, the patient has to rinse the mouth thoroughly after inhalation. We have seen many patients of asthma using steroid inhalation developing the fungus. Therefore, it has to be treated in time and patient has to take care. For rinsing the mouth, immediately after use of steroid inhalation. For denture wearers, they have to clean dentures with anti-candidal preparations. They are available in the market, and they have to remove the dentures at night. So they have to clean the dentures, they have to keep the dentures dry, and they have to wear the dentures in the morning time. That leads to at least prevention of oral candidiasis. This ends the presentation on oral candidiasis. At the end of presentation, I hope that you are aware with around 50% patients, Candida albicans as the commensal in oral cavity. Candida can cause infection when the patient has decreased immune system. The best treatment for oral candidiasis is avoidance of the risk factor, and good oral hygiene helps in prevention of oral candidiasis. Denture wearers should clean the denture with anti-candidal preparations at night, and they have to use next morning, and they have to remove dentures at night time. This helps to get rid from oral candidiasis. Thank you very much.